How is it that the wealthiest country in the world has such a screwed up healthcare system? After 35 years in the healthcare industry, I decided to retire and share my secrets with you. I'm Chuck Melendi, and this is Disruptive Dialogue. Hey everybody, Chuck Melendi with Disruptive Dialogue. This is my second podcast, and it is called Follow the Money. If you didn't get a chance, my first podcast is called The Wake Up Call. Give it a listen. I'm going to tell you about who I am. If you want more detail, go to the first podcast. But basically, I've worked in the healthcare industry for about 35 years, the last 25 with Johnson & Johnson. I've had the opportunity to do all kinds of things, especially negotiate drug prices with insurance companies and pharmacy benefit managers, or PBMs. The last 7 years, I actually worked on legislation with physicians, employers, patient advocacy organizations to try and change the healthcare system. My goal of this podcast and all my podcasts is to bring to people who are not in the healthcare system what is going on in a manner in which you can understand. If you don't understand it, it's okay. The giants of this industry, which has turned into a money-making machine versus healthcare, they try to make it complicated so that you and the politicians and the media don't understand it. If you don't understand it, it's hard to fix. Bottom line, and I said this in the first episode, Americans are being ripped off when it comes to healthcare. We do a lot of things well in this country. Healthcare is not one of them. It has nothing to do with the doctors, the nurses, the pharmacists, people trying to make products and services that help patients. That has to do with the system. There was a study done by the Virginia Commonwealth Fund. It looked at the U.S. versus 10 other developed countries. It showed that we spend twice as much on healthcare and we have worse outcomes than all 10 of those countries. We're at a point in time where we spend almost $5 trillion of our economy every year just on healthcare. That's almost $15,000 per person. And it's not just about bad healthcare. It's about inflation. It's about hurting our economy. It is about our companies not being competitive in the global marketplace because our employers are paying almost $25,000 per family that they support with their members versus countries that don't have anything close to that. So it needs to be fixed, not just for healthcare, but for our country and our economy. So if you're going to solve any problem, I think there's a couple ways to do it. And the first one, I think we will all agree, is follow the money. Who's making all the money? That usually starts where the core of the issue is. After you determine that, then find out who's actually needed and who can be eliminated to get a healthcare system like it used to be that's value-based. And then once we get to that point, what can be done? How can we fix it? As I said on my last podcast, I'm going to talk about issues that are out there. I'm going to call out the bad players and spare no one because everybody has a piece to play in where we've gone. But it's going to take you. You're going to have to help. We can do this, but we're going to have to do it together. I know everybody has heard that drugs cost more in the U.S. than in other countries. Well, let me give you a shocker. Every aspect of our healthcare system costs more in the U.S. than other countries. Our hospitals are more expensive. Insurance companies, oh, wait a second. They don't have insurance companies in some of these other countries. The PBMs that manage the drugs, they're not there either. But drug wholesalers, they do a little bit out there. Medical devices, physicians' offices, every sector is more expensive in the U.S. than outside the U.S. So let's follow the money. Who's making it all? This is my spoiler alert. This is how I used to start my talks, and this is what I tell my friends just to give them a little bit of a shock. So I say, yeah, I used to work for Johnson & Johnson. J&J is the largest drug manufacturer in the entire world. Their revenue last year was $85 billion. That is a ton of money. But they've been around a long time. They make a ton of drugs. Then I say, how much do you think UnitedHealth makes? Now, UnitedHealth Group, they are the largest entity of the insurance companies. They made $400 billion. Now think about that. Johnson & Johnson, we actually make stuff $85 billion in 1 year. UnitedHealth Group, $400 billion. That is crazy. And if you don't believe it, look it up. So The decade 2010 to 2020 saw unprecedented growth in U.S. healthcare spending. And I've ranked, and you can see it in my show notes, you can see it on YouTube. I've ranked the largest healthcare companies according to the Forbes 500 that contributed greatly to that explosive growth during that period. And I'm going to focus on revenue. You might hear me say, so-and-so made $400 billion. I'm talking revenue, not profit. So I focus on revenue because guess what? When they say the spend in the U.S. on healthcare is $5 trillion, that's not profit. That is revenue. Revenue is what hits. I'm going to focus on revenue and not profits because at the end of the day, profits can be manipulated. You can give more to your healthcare executives. You can hide it through accounting manipulations. Bottom line, if UnitedHealth Group made $400 billion or had revenue of $400 billion, that's what the U.S. economy, that's what we feel, not what their profit is, what their revenue is. So that's what I focused on. So I'm having to use my big laptop over here because it doesn't come up on this little iPad. But I'm just going to touch on the top 2 companies in each sector. The first one I'm going to touch on are the 2 biggest. Now, from 2010 to 2020, this was a decade where, to me, healthcare expenses exploded. And so I said, you know what? I want to find out who grew the most, who had the biggest revenue growth during this period. So I went to the Fortune 500. I pulled up the top 200 companies in the US, and it's kind of shocking. You can look on YouTube or you can pull it up in the show notes. But the fastest growing company in healthcare during that period was an insurance company called Centene. You've probably never heard of them. Centene grew 1,657% during that 10-year period. Now, sure, some were acquisitions, et cetera, but their revenue went from $4.2 billion to $74 billion. The second fastest growing company was Cigna. Cigna, which merged with Express Scripts, which is one of the big PBMs. They grew during that period 247% from $46 billion to $160 billion. Now, there's companies in a sector of healthcare that I'm going to dig into later in future podcasts that I don't know a ton about. They drug wholesalers, and what they basically do, and we're going to break all these things down by sector. They basically buy drugs from the manufacturers and distribute it to all the pharmacies, hospitals, et cetera, across the country because manufacturers couldn't do that. But it's shocking how much money they made. During the period 2010 to 2020, AmerisourceBergen, which has changed their name, forget the name, but we'll touch on it in a minute, 165% from $71 billion to $189 billion. McKesson from $106 billion to $238 billion. So what about hospitals? Well, we're going to get into hospitals. They love to be not-for-profit, and we're going to dig into that. But the only for-profit hospital is HCA. They grew 71% during that period from $30 billion to $51 billion. Kaiser, which we'll touch on, is a $100 billion hospital, but they're not-for-profit. I don't have that. It's not in Forbes, so I didn't pull it in. But you're going to say, okay, wait a minute. You talked about insurers, you talked about hospitals, you talked about wholesalers. What about the manufacturers? Well, the biggest manufacturer, my old employer, Johnson & Johnson, during that period, they grew $33 billion from $61 billion to $82. Yeah, that's not growing by 120 billion. They grew $20 billion. And the second largest one, my screen just gave out on me, was Pfizer. We all know about Pfizer. During that period, they grew 3%. From $50 billion to $51 billion. Merck actually lost $500 million during that decade. That's some perspective for you. You have insurers, you have PBMs, and you have drug wholesalers growing by tens of billions of dollars during this 10-year period. Your manufacturers are barely growing. And I've already said in my previous podcast, I'm going to tell you things that are going to shock you, because that's not what the media puts out there. That's not what a lot of messaging out there, but look it up. I'm going to start with the big boys. And the big boys basically are the insurers. So in 2023, the 5 largest insurance companies in the U.S. ranked among the largest 25 companies in our country. These 5 companies had a combined revenue of $1.25 trillion with a T dollars. 5 companies, $1.25 trillion. People ask, why is the cost of U.S. healthcare so more expensive than outside the U.S.? And they're like, drug costs. Look, they don't have insurance companies over there in Europe. I was over there. I had 2 kids when I was over there with my wife. They had broken arms. We went to hospitals. We went to doctors. Everything was fine. There were no insurance companies. 5 companies made $1.25 trillion. Okay? That's a big reason why it's more expensive over here. In a recent Gallup poll, and this is in the last 2 months, this is shocking. Americans ranked improving healthcare access and affordability as the highest public health priority for government leaders. This was ranked over ensuring the safety of our food and water supply, and it was ranked over reducing chronic diseases. That's insane and lets you know how bad it is right now. And before they try, and they always do, the insurance company blame everybody else. They are the ones that establish access and affordability in the U.S. healthcare system. They're the ones that say what doctors you can go to, what pharmacies you can go to, how much your service is going to cost, how much I'm going to pay a doctor, how much I'm going to pay a hospital. They're the ones that determine all of that. And how much the employers are going to pay for your insurance and you with your premiums, your deductibles, etc. So at the end of the day, if we're more expensive over here in the U.S., but we have less effective outcomes, what are they doing? Do we need them? So let's break it down. I'm going to just go to the top 5. I'm not going to go to the top 12. It's ridiculous. But we're just going to do top 5. The top 5 insurers, and this is 2023, not 2024. The first one is UnitedHealth. They are the 4th biggest company in our country. They brought in 2023, $371 billion with a B, $371 billion in revenue. Aetna, which merged with CVS, they were number 6 at $357 billion. Cigna, which merged with Express Scripts, came in at number 16 at $195 billion. Elevance, a new name for Anthem Blue Cross, came in at 21 with $171 billion. And then that one insurance company I told you that grew so much, Centene, they're in at number 23 at $154 billion. Do the math. You add up those 5 large insurers, their total revenue is $1.25 trillion. Now, we're going to go after what I like to call healthcare's easy button, the drug manufacturers. And the reason I call them that is because everybody takes drugs, so everyone's familiar with it. You don't go to the hospital all the time. You don't deal with insurance all the time, but everybody goes and gets their prescriptions, etc. And we have all these commercials on TV, which I hate, but we are what you think about when you think of high healthcare costs. And look, we have our bad players. We have the Purdue family and what they did with opioids. We had the hedge fund guy, Martin Shkreli, farm bro, they called him, that bought a small company and jacked up the price of that drug thousands of %. He actually served 7 years in jail. But we're not talking about the bad players and what they do. We will break it down in future episodes. We're just talking about who makes the most money. So of the manufacturers, J&J, Johnson & Johnson, is the largest drug manufacturer in the world. In the U.S. in 2023, in this same ranking, they came in at number 42. Not top 25 like those 5 insurers, number 42. If they were an insurance company, they'd be the 7th largest in the insurance company. Think about that. Johnson & Johnson isn't even in the top 6 as far as size goes with insurance companies. And I'm going to break down each one, what they made. But here's a good figure to just mull over. If you added the revenue of the 5 largest drug manufacturers in the world, and that's Johnson & Johnson, Merck, Pfizer, AbbVie, and BMS, their total revenue would be $311 billion. Think about it. The total combined revenue, the 5 largest drug manufacturers in the world, is less than the revenue of UnitedHealth Group. And it's less than the revenue of Aetna, CVS. What the hell? Those guys don't make anything. It's crazy. They don't have R&D. They don't have to do any of that stuff. And they make that much money. But to be fair, and it's on the website, and it'll be in the show notes and on YouTube, J&J came in 2023 at number 42 at $95 billion, Merck at number 67 at $60 billion, Pfizer at number 69, $58 billion, AbbVie at $77, at $54 billion, and then BMS $44 billion at $98 billion. I'm not saying they don't make a lot of money. I'm not saying that's not a lot of money. I'm not saying that they make too much profit. What I'm saying is they're not even close to being the giants in healthcare. And if you want to make a huge impact, we need to start looking at those that are making all this money. So let's talk about hospitals. Hospitals are tricky. 1/3 of all U.S. healthcare spend comes from our hospitals. The issue that I have with them is that they have been 1/3 of healthcare spend for over 3 decades. Now, the last 3 decades have seen so many advances in devices, in technology, and in drugs that have reduced the need for hospital services. Yet, their spend doesn't go down. It keeps going up. And it makes you wonder, where's all that money going? Because I will tell you right now, I walk into hospitals, the docs and the nurses and the pharmacists are stressed out. There's a shortage of personnel. They don't make enough money. They work long shifts. Where's all this money going? I think you know. The fact is, the hospitals are making so much money right now that they are buying up physician practices. And what's disgusting is they buy these physician practices that are maybe 2, 3, 4, 5 miles away. And then the same services provided by that physician, if the physician's infusing drugs, the same drugs infused by that physician, the prices are now double and triple what they were before the hospital bought them. Study after study after study shows that when health systems come together, when they buy physician practices, when private equity gets involved, prices never go down, just their revenue goes up. They're making so much money now that they're ignoring laws. So laws have been passed for transparency, for surprise billing. You may have heard of some of these, you may not have, but they just ignore it because the enforcement of these laws and rules are fines. But these companies make so much money, these hospitals, they just pay the fine and keep doing business as usual. There is a federal law that tells hospitals that they have to be transparent. Right now, the compliance with that is around 20% of the hospitals. That law is over 3 years old. Where is the enforcement? Nearly 60% of hospitals also say that they're not for profit, but they act like for-profit entities. Look, hospitals serve a vital role in our community. The healthcare professionals in the hospitals do an incredible job under incredible pressure. But when you have a hospital like New York Langone, which is a charity hospital in New York, spend $8 million on a 30-second commercial during the Super Bowl, it shines a spotlight on the question of, what are they really using all that money for? So I'm going to let you go to the website. I'm not going to bore you with all the numbers, but basically the biggest hospital out there in the country in 2023 was Kaiser Permanente in California. They are a not-for-profit, as we like to say, not paying taxes, organization at $101 billion, HCA at $65, and then a few others that are there. And then I really want to touch quickly on the drug wholesalers. Look, once again, I'm going to dive into them in a future episode. We're just going to talk about the big three. Look, the big three wholesalers, they control 85% of the pharmaceuticals in this country. They make a ton of money. McKesson came in as the number 9 largest company in the U.S. at $276 billion in 2023. Cencora, which is AmerisourceBergen, came in at number 10 at $262 billion, and Cardinal Health at number 14 at $204. These 3 large drug wholesalers, 3 companies, had a total revenue of $742 billion. Now go back again. Remember, 5 biggest drug manufacturers, 311, 3 wholesalers, 742. Not saying who's innocent, who's guilty, just saying who's making all the money. Look, I'm not against making money. It's part of our capitalist society and we're proud of it. But are there no guardrails? Healthcare isn't optional. It's not like, you know what, that sporting event is ridiculous or that concert is overpriced. I'm not going to go. Look, if you, a child, a parent, a friend gets sick, you have to be cared for. We have all worked hard and we have been paying for our insurance. Our employers have been paying for our insurance for years. We don't use it very often. When we do, when we need the care, it should be available quickly and effectively. And that is not happening. The U.S. healthcare system today focuses more on making money than caring for patients. And the gatekeepers of our healthcare system are publicly traded companies. That's right. The insurers, the PBMs, they're publicly traded companies. Their fiduciary duty is to shareholders, not patients, which means they have a legal obligation to make sure they take care of the shareholders, the stockholders, not patients. Physicians, their fiduciary duty is to you, not the health insurance company. So what I did was I said, you know what? Let me simplify it. Let me put this in the context of food. So let's pretend that getting our food was similar to how we get healthcare. And I use food as an example because just like healthcare, we need food to live and function in our society. This is not something that's optional. So now let's imagine if we were limited to only 2 or 3 grocery stores in our community. What would happen if the brand name food items that we bought all the time started to get really expensive? Well, I'll tell you what we do. They get too expensive, then we just start buying the store brand. I don't need to have the brand that's super expensive. But all of a sudden, which happens in healthcare, what if the prices of the unbranded items start to go up? And even worse, what if they start to disappear from the shelves so that we really don't have any options but to use the expensive food items? Now, we're talking about a situation where people who are employed and who work hard and make a decent living can't afford their groceries. So they have to get by on less food, or they go into food stamps, which guess what? We all pay for. I like to call that corporate welfare. I should term that into phrase. Or instead of food stamps, they just find cheaper food. That's not very healthy. That's probably ultra processed. Well, now you have, as a result, their health starts to falter. So now we raise hell. We go to our lawmakers and we say, you need to pass legislation. This is ridiculous. You have to rein in these companies' bad practices. So some legislators actually start to pass some laws and rules for these companies to live by, so that they're not doing all these bad practices. Unfortunately, like in healthcare, these companies make too much money. So instead of following the laws or rules, they just go, you know what? I'll just pay the fine. It's a cost of doing business. I'm just going to pay the money. I don't want to have transparency. I don't want to have accountability. I don't want to have to do what they tell me to do. I like what I'm doing. Ladies and gentlemen, welcome to healthcare in America. So look, I'm going to start to wrap this up. In a high-functioning healthcare system, we all need the doctors, the hospitals, the pharmaceutical products, the pharmacists, devices, you name it. But there are 8 companies in our healthcare industry that make over $2 trillion, the middlemen. Those insurers, the PBMs, and the drug wholesalers. They have little to no impact in countries outside the U.S. And don't get me wrong, there is no doubt that drug manufacturers, wholesalers, hospitals, and even some providers have also played a role in the rising cost of healthcare. But they are not the worst offenders. And while we will talk about how they can improve in future episodes, right now we are focused on the true giants of healthcare. Unfortunately, as these companies have grown, they've also become very powerful in Washington and in the state capitals. They try to confuse the public, the media, and the politicians by spending millions of dollars. Just ask, who's my whistleblower? Wendell Potter. Just ask Wendell Potter, who used to work at Cigna. They spend millions of dollars promoting the idea that Americans and their employers are happy with the current system. That is a farce. So look, I wasn't going to pick on any one company, but I can't help it. About 3 weeks ago, UnitedHealth Group's CEO, Andrew Whitty, came out. And look, first off, I need to acknowledge that the insurance arm of UnitedHealth Group, UnitedHealthcare, their CEO was shot and murdered in broad daylight, and that is awful. And when I say take action, that is not the action to take. That is horrible. I don't care who you are, who you work for. What was more shocking was the reaction of the general public. There was so little empathy. And I think that shows the underlying vitriol that our public feels right now towards our healthcare system. But the arrogance of Mr. Whitty when he came out blows me away. One of his statements was, the healthcare systems needs to be less confusing, less complex, and less costly. I'm like, really? You make $400 billion a year in revenue. You're the gatekeeper of healthcare. You're the one that is making it more costly, more confusing. Then he said, fundamentally, healthcare costs more in the U.S. because of the price of a single procedure, a visit, a prescription drug. They're higher here than they are in other countries. Well, guess what other countries don't have, Mr. Whitty? They don't have an entire industry that is the gatekeeper for the healthcare system and yet makes so much money, more than anybody else in the industry, and answers to shareholders. And then he went on to defend his PBM. I'm just not going to get there right now. It's too much. So at the end of the day, you're like, well, Chuck, that's fine. Okay, I haven't been sick any lately. No one in my family doesn't really impact me. It does. Here's the fallout. These middlemen are destroying not just our healthcare system. They're tearing apart our country for their financial gain. Physicians are burning out because the insurers have made it so difficult for them to practice medicine. They can't do anything without asking the insurance company if they can do it. Independent pharmacies are disappearing by the thousands and going out of business every day because the insurance companies try to send all their business to the pharmacies that they own. How is that not anti-competitive? Employers continue to face rising healthcare costs, which, sorry everybody, holds your wages down and increases the cost of goods. People are avoiding care altogether. They're not getting their meds filled. They're not going to the doctor because they can't afford it. And if they have no choice and they go, half the time they go into medical debt because, sorry, hospitals, you guys are upcharging almost everything. Look, we're paying more and more in premiums and deductibles, while the system, the insurers, through their benefit designs, make it harder and harder for us to use healthcare. The healthcare that we've already paid for. The healthcare in the U.S. is one of the greatest threats, in my opinion, to the mental, physical, and financial health of our country. And yet, the politicians doing their soap opera, talking about who drinks too much and who cheats on who, I could care less. Do something like fix our healthcare system. Don't let this continue. This isn't a partisan issue. I don't care if you're a Democrat or a Republican. All of our politicians need to step up. This impacts every person in our country, and we all have to get involved. We cannot leave it up to them. So look, I'll close with this. I retired early to do this. If you've worked for a hospital or an insurance company or a PBM, and you want to share your stories, you want to come on the podcast, that's fine. If you don't want to come on the podcast, reach out to me. Tell me what's going on. If you're a patient and you have an incredible story, yes, we hear them in the news, but there's a lot more happening. When people heard I was going to do this podcast, you wouldn't believe all the nightmares that they told me they were dealing with. Give me a call. Go on the website. We'll have a forum. My great wife has created a website, and we will provide resources on there. We'll provide links that you can just click on a link and it'll take you to your legislature. And you can reach out to them. You can have a voice. If you know someone in the media, get a hold of them. Look, we have to unite. We have to fight together. Subscribe to my podcast. I'm not making any money off of it, I swear. And share it with everybody you know. We must not accept that our friends, our family, our kids, our grandparents are being robbed not only of their health, but of their money. We live in America where making money is admired and it is encouraged, where an honest day's work deserves an honest day's pay. But when you are not providing a good product, when you're not caring for the people who pay for healthcare, and when the rest of the economy is being harmed by your greed, something's wrong and something needs to be fixed. Once again, none of it matters. Everybody listening, none of it matters if you don't get involved. Use this podcast. Spread the word. If you don't believe me, go to the Google, as my mom would say, and look it up. Facts are facts. Good luck. Take care. And I'll see you on the next podcast.